in the future?
Governor, this is David Ramsey with the Arkansas Nonprofit News Network. While we await the vaccine, the National Academy of Medicine and 9 other national organizations last month issued a call for states to establish statewide crisis standards of care plans for the pandemic. And my understanding is that I think more than 30 states do have a crisis standard of care plan in place, basically something that would establish protocols for how to allocate scarce resources if the capacity situation does reach a kind of crisis point, and to kind of have a plan for that statewide. My understanding is that's kind of in development in Arkansas. I guess, could you
Good afternoon. Hope everyone is doing well. Awaiting the governor, and I heard him earlier right when the stream started, but it sounded like he might have been in another interview before coming out here to this one here. But anyway, this will be a COVID update, particularly with schools. Not sure. I have not seen anything particular what this will be, so we'll kind of all learn at the same time here. As we await the governor, a few things to pass along here as far as COVID is concerned. This is a COVID stream, so we'll kind of go over the numbers here. The latest numbers for Logan County. Total cases, confirmed cases, 3,105. The death number for Logan County now is at 15. 15 total cases related to COVID by the state health department. And there's been 2,687 recoveries. So as of right now, the state health department is reporting 403 active cases here in Logan County. Again, about 48,000 people in the county. Also, as you probably saw on Guthrie News page last week, the health department, Logan County Health Department, held the vaccination for healthcare workers and those over 65 years old. There's another one this week. From my understanding, the appointments have already been filled up, and the Thursday event will be from 9 a.m. to 3 p.m. And the Logan County Health Department just informed me to pass some information along, which I will tell you now, and then I will get an article written here in just a little bit. But again, we're waiting on Governor Kevin Stitt and Dr. Frye to join us here in a matter of moments here. And I have the audio up, so as soon as they start, I will pipe off. I will pipe it down and get right to them. But this is coming from the Logan County Health Department. Looks like we're getting ready to get started, but I'll try to go here real quick. The Logan County Health Department will hold its second COVID vaccine event this Thursday, January 14th from 9 to 3. I'll talk about it after this. I don't think they got his volume up. Yeah, there's no audio. I was wanting to make sure it wasn't just me, but there's no audio coming from this meeting. So his staff is going to have to get that figured out here pretty quick, hopefully. And the governor won't get too far in this, but he is talking without any audio. Hopefully they're working on the audio. There is no audio coming from the governor, so someone needs to let him know so they can stop and I have done this a time or two with no where I accidentally didn't put any audio on or whatever, or were muted or thought I was muted. But right now there was no. There's everybody in the chat forum. This is through a Zoom meeting for the media members. Looks like a few media members made it there, but majority of the people are unable to get this. I think this press release came out about 10:30, 11 o'clock this morning. So, of course, if you live in Guyman or Tulsa or somewhere you're not unable to get there, or you have other plans. But this is a Zoom press briefing, and no audio. We heard audio earlier. I don't know if we were intended to hear the audio, but I don't know if they're going to be able to get this fixed or not. You can probably see there in the bottom of your screen all the comments coming in from the media members that there is no audio. So I guess we'll just kind of wait this out and see if they start over, if they don't start over, or what's going on. So Brittany liked the music was a jam. That's the only audio. I can control the music, the audio, but there's definitely no audio coming from the Zoom, and the messages continue I don't know if they're working on it or if they even know about it. And so the governor's just getting after it. I'll look at the comments real quick on here, see if there's anything that I can see. Yeah, well, as you read the comments there, it does not, I don't know if they're going to notice in time or not, so. Blake, if I could do that, I would, that would be awesome if I could do that. But it's amazing how they put that. I wonder how long that takes. Blake talking about the lip reading for NFL and politicians. There's been a lot of good ones out there. I wonder how long that takes to put that together. They do an amazing job with there. So, well, I don't know if we can just spin our wheels here and just. I would guess if they do figure it out, or if it's an audio glitch or what. I don't know if he would start completely over or not. But it looks like it's a prepared statement. Dr. Lane Frye was there we go. Oh, maybe. Come on. Sounds like they're working it out. It sounds like it is a technical issue, and they're just trying to figure it out.
School boards are putting their students first. The biggest challenge facing lots of school districts is quarantines. The American Academy of Pediatrics found requiring students and staff to quarantine when they were all wearing masks, quote, is counterproductive and created substantial staffing shortages with little gain in public safety. It found, as evidenced by these data, secondary transmissions in the setting of masking is uncommon, and this policy discounts the benefits of masking and sends a mixed message to the public on the benefits of face coverings. Today, we're announcing a new policy that will help us keep our kids and our schools open safely. It will also help encourage and reward mask wearing in schools across the state. Moving forward, schools that enforce the use of masks will not have to quarantine potential exposures unless they are showing symptoms. This is what's best for our students, period, end of story. I'll turn it over to Dr. Frye to share some more details about our new policy. Dr. Frye.
Thank you, Governor. As Governor Stitt shared, we continue to focus on keeping our teachers and students safe in the classroom by supporting them through appropriate resources and policies. Our parents, students, teachers, and school administrators have been doing an outstanding job keeping our students safe. We've seen very little spread of COVID-19 in school settings, in part because our school districts are being diligent in their safety precautions, for which we are very appreciative. We know when safety protocols are followed consistently, like washing your hands, watching your distance, and wearing a mask, our schools have been and will continue to be one of the safest places for our students. A Rockefeller Foundation study found that in schools and universities that have instituted regular rapid turnaround testing, coupled with mandatory mask usage and social distancing, transmission rates are extremely low to non-existent. We want to continue to provide these important tools that are so important for preventing the spread of COVID-19 in our schools. Today, we're announcing new guidance aimed at keeping our children, teachers, and staff in school. First, we are working aggressively to get teachers 65 and older vaccinated starting this week, and anticipate vaccinating teachers as a whole as soon as our vaccine supply is available. Oklahoma has done an outstanding job at administrating vaccines quickly across the state, putting us most recently in the top 10 for distribution, making Oklahoma more competitive to receive large tests we will be providing to schools to encourage frequent testing in order to catch positive cases early. In addition to aggressive vaccine distribution and more testing, we will be also increasing the supply of masks and PPE made available to our schools. Furthermore, we're announcing a change in school quarantine policy. We're doing this to keep our kids safely in school while encouraging proper mask usage. Students and teachers exposed to someone who tests positive for COVID-19 in school will no longer be required to quarantine as long as the exposure happened in a classroom setting. Everyone was wearing masks and following other appropriate protocols like social distancing. Schools should continue to require quarantines for exposed students in situations where masking and distancing protocols were not followed. Additionally, this updated quarantine guidance does not apply if exposure occurs during after-school activities, including sports. The new guidance still requires the person who tests positive to isolate at home. I can't stress enough the importance of continued mitigation strategies while also providing kids the opportunity to thrive in the classroom. As long as schools are following proper safety procedures, we won't require them to quarantine automatically because of people exposure. Multiple other states like Missouri, Utah, and Ohio, and others have gone in this direction and have not seen increased outbreaks in school settings. A recent Ohio study showed that children who were close contacts and appropriately masked had rates of COVID-19 that were similar to children with no known COVID-19 exposures in school. The CDC notes that it's critical for schools to open safely and quickly because of the vital role they place in children's educational achievement, health, and well-being. As a medical professional, I can tell you that public health is about balance. In this case, we need to balance the safety of our students, their families, and our education professionals with other public health factors. Our students' mental, physical, and social development are also important concerns to consider. I'll now turn it over to Secretary of Education, Frye.
Thank you, Governor Stitt and Dr. Frye, for making it a priority to get Oklahoma students safely back to school. All of us are here today because we want what's best for kids. As a teacher, I know there are students and teachers all across the state that desperately want their students back in their classrooms. We know parents, grandparents, daycares, and others have stepped in to fill the gap for many of our students who haven't had access to in-person instruction yet this year. We know that young students struggle with virtual learning, and we think they need an option to come back to school in person. We also know that there are students who need classroom support that are falling in the cracks, that are struggling academically behind the screen. We know that keeping kids out of school and away from their peers takes a toll on both their mental health and their well-being of these young students. Studies have shown diminished instruction for even a year can negatively impact students' successes throughout their careers. Graduation rates, studies have shown that graduation rates can drop as much as 9% amongst high school students as a result of these school closures. According to a recent McKinsey report, the prolonged period of remote learning dramatically affects educators, parents, and teachers, from rising rates of depression and anxiety to the loss of student learning. Data from Curriculum Associates suggests that only 60% of low-income students are regularly logging in to online instruction. Schools have been asking for this change because they've been quarantining hundreds of students without seeing a spread of COVID. This is a testament to schools following safety protocols. We know that we can open schools safely. I want to thank our schools for this commitment to safety policies that has resulted in this incredibly low number of students testing positive in quarantine. And I want to thank the governor and Dr. Frye for thinking about ways to keep our kids safe while prioritizing getting them back to school. The long-term impact of our students going another semester without the in-person learning option would be catastrophic academically, emotionally, and physically. I am confident our teachers and school leaders will continue to take every precaution to keep themselves and our students safe, and we are here to support them. I will now turn it back over to Governor Stitt for a few questions.
Thank you, Secretary Walters. Thank you, Dr. Frye. The data is clear. In-person school is safe, and it's what's best for our kids. I believe in local control. That means I'm going to continue to fight for Oklahomans to have the right to decide what's best for their kids. Parents need the option to get their kids back in school. Decisions about schools should be made by parents at a dinner table, not at a union hall by people with their own agenda. Before I close, I want to share a few other quotes with you from people who agree with me that we need to reopen schools. Quote number one, medical research as well as data from around the world make clear that in-person learning is safe when the appropriate protections are in place, even in communities with high transmission rates. Quote number two, what this all boils down to is giving families the option to make the best decisions for themselves. Quote number three, the value of in-person learning for our kids is immeasurable, and we must do everything we can to help them get a great education safely. Over the last 10 months, medical experts and epidemiologists have closely followed the data and have learned that schools can establish a low risk of transmission. The first quote was from Governor Cuomo of New York. The second one was from Lori Lightfoot, the mayor of Chicago. And the third one was from Governor Whitmer of Michigan. Even the most liberal people in the country who have locked everything down know going back to school is the right thing to do. Oklahomans continue to demand that your local school boards put your kids first. Speak up, get involved. At the same time, thank your local superintendents and school boards if you have the option to put your kids in school. Sadly, just a few blocks can make a big difference in the world. Students in Broken Arrow were able to go to school for 66 days in the fall semester. The state's largest high school found a way to get this done. They innovated, they had bold leadership, committed to putting students first. Just minutes away is Tulsa Public Schools. Their high schoolers haven't been in the building for 305 days. 305 days, all because you live a couple blocks the wrong direction. Let's do the right thing. We need to put our students first. We need to get them back in the classroom. We'll open up for a few questions.
Governor, part of the thinking here is,
Go ahead.
part of the thinking here is about the schools are actually enforcing masking. Why not encourage or even enforce all school districts to require masks all the time in your education?
Well, again, we've been saying from the very beginning since March, wear your mask. And I want to say it again, wear your mask, wash your hands, watch your distance. It's not about magic words, it's about compliance. Most school districts are doing this. I believe that more school districts, even if they don't have a mask mandate, will do it now since the quarantine rules have changed. I think it's a great question. It's a great opportunity. Now that they don't have to be quarantined, if they're both safely wearing masks, I think that's exactly what this is for. That's why the Department of Health rolled this out.
Governor Stitt, many schools are on the A and B schedule, and I've heard from a lot of them it's because of staffing reasons. They have to go into quarantine. Do you think that this new policy will help them maybe go back to 5 days? Would you like to see kids in school for 5 days?
Absolutely, and that's one thing that Secretary Walters, I'll let you kind of add to it. That's one thing we've heard from superintendents across the state of Oklahoma as they talked to the Department of Health and shared their concerns. That there was a quarantine problem. You had people in and out, and as soon as they were exposed to a student, even though there was no transmission, nobody ended up with having COVID. The in and out was problematic, and so Dr. Frye and his team did a fantastic job of studying what they did in Ohio, Missouri, Utah, looking at the data, and then the study that we just talked about from North Carolina was all part of the decision making to hopefully get those kids from A and B. I've talked to a lot of parents on the A and B schedule. It's just not the same. The teachers are complaining about it. We're hearing from students around the state. They're just not getting the education that they think they need, and we think that this is going to help them go to a 5-day week schedule.
Governor, what is your thought on some bills that are filed as far as, I think one even said it would be unlawful for a school district to require their students to wear masks. Are you ready to veto those things? I mean, you just said local control. Some of these would strip city council. Some of these would strip school boards of this power. What are your thoughts on those?
Specifically what bill you're talking about. We obviously, we'll cross that bridge when they come to me. But no, we like we said before, have no plans to veto a bill like that.
A quick question on vaccines. Dr. Frye mentioned teachers 65 and older will start getting vaccines this week. Do we know yet about when we could be looking at all teachers in the state having the opportunity to get the vaccination?
Great question. Short answer is no, not yet. It's very much dependent on vaccine supply, vaccine availability. There's some new information that came out from HHS today indicating that they're pushing more vaccine to us. They're no longer holding back second doses. We're going to take a look at that, see how that fits into our plans. You probably heard from them, if you're paying attention to that they're encouraging us to roll in other groups as quickly as we can. They talked about encouraging states to do a similar plan to what we've already initiated. So as soon as we feel like we have sufficient vaccine and we can add those groups, we're definitely going to add those groups. We're not going to wait to finish all 65 and older. We're not going to wait to finish all those under with comorbidities. We're going to get to them just as soon as we can, but it's absolutely a vaccine supply.
If I could follow up on that, teachers often receive like flu shots right there at school. Is that something maybe they can expect to just walk down to the office and get a COVID shot and go back to teaching that day, or are they going to have to go to a clinic like everyone else?
So there are several options that we're looking at on how we would administer vaccine to teachers in those settings. First of all, I want to reiterate what's already been said. Teachers that are 65 and older, we're working on getting them vaccinated now. When we roll out that next group of those under 65 that have comorbidities, we're going to encourage them to get vaccinated immediately. When we get into a broader group, teachers within the school settings, we talk to them about several options. The big thing to keep in mind is we've got to maintain high throughput on our clinics. We can't break down a lot of our resources to go do isolated pods and then miss the opportunity to run a lot of Oklahomans through those clinics and get vaccinations into them. But we're looking at some of our resources we have that may allow for some more strike team type approaches in those settings to take care of teachers, or we potentially could have special pods. So we're going to help facilitate get them vaccinated as quickly as possible.
Deputy Commissioner, just to follow up on that, you don't have any second doses set aside in Oklahoma, is that right? That so could be turned into first doses?
Is we're still operating under OWS's system, Operation Warp Speed, their system of holding back second doses. They're shipping at 3 weeks for Pfizer, 4 weeks for Moderna. What they indicated today that there is a change coming, and they will start shipping all that at one time. Currently, the boost doses, the second doses we have in the state, have just come on board, and they've just come on board and into our inventory in time for those second doses. So no, we do not have a cache of second doses that we've been holding for time for them to come due.
They've actually been telling you these are boost doses, and we're sending you today, use these for boost doses.
That is correct. When they do the allocation for us, we get essentially 2 categories. We get prime doses, which are for the initial dose, and then we get a category of boost doses that are designed specifically for the second dose.
What is going to be the strategy if they do open the floodgates and just let it all flow in? I mean, are you guys going to try to vaccinate as many people one dose, or are you going to plan on giving people the recommended FDA dosage of 2?
So we are engaging in meetings right now. This is new information. We talked about how flexible we have to be with this vaccination rollout, and this is another example of the rules of the game have changed essentially and been tossed on us. We're meeting to discuss what that means for us and our plan. We want to adapt in such a way that we can maximize the amount of doses for Oklahomans, but also be responsible for ensuring that there are boost doses available as well. A lot of the information that's coming down is still incomplete. For example, is there going to be enough of a regular supply of vaccine
Governor or Mr. Secretary, either of you or both of you could kind of chat about this. I got two kind of questions here. One, you talked about the data that you're using to make these decisions. Are you already collecting data on districts that have been open, or you were citing national studies and things of that nature? So is there any effort, or is there going to be any effort based on when some schools may reopen? And then two, can somebody talk about, this strikes me, and maybe I'm just observing it, but I think a lot of people who have kids who have to go back to work have their children in daycares, and their children may be involved in distance learning. So you have a daycare that may have 2 or 3 non-teachers who are helping students of different grade levels, different districts, different computer programs, all the things. They are the ones who are leading the instruction often for some of these students in daycare. So have you guys studied that? Have you talked to anybody about that? You say.
We're going to split this, and I'll take the first part of that. There are many school districts throughout our state that have been following their data, have really excellent data that was looked at. The question that was always out there was, are they having low numbers of positives because they aren't testing? In other words, they quarantine, they go home, they say, well, we have very few kids test positive. So it was just a big unknown, and we were really waiting for answers to that question. So while we're going to initiate a study here in Oklahoma, some other studies did much larger numbers before we did. And so now that they've published that data, we have data out there that we can use. So now we have the information, and we suspected that we knew we were going to be getting to this at some point in time, but we wanted to make sure that we had the data to support our decision.
Thank you.
I think that's a great question. So let me just start by talking about the data that we do have. So some of the data we have is basically how kids are doing, how students are doing in districts that have gone virtual. So you saw earlier, I was talking about how many classes they failed. But the difficulty in determining how far academically they've fallen is different districts use different type of benchmark testing. We are looking to see some of that data to see where our students are in relation to a statewide standard, national standard. And again, at the end of the year, there will be those standardized tests where we can review that. But currently, we've got districts that use different types of benchmark data. So we are looking at that too. But right now, kind of the data set that we have, the students failing classes. And I would like to reiterate, I think it's very important to make the distinction that there are some students that are successful in virtual options and like that virtual option. We're not talking about taking away the option. Our concern is, again, in all of our policies, we try to do what's best for all Oklahoma students. And we think that all students deserve that option. And for us, the governor is passionate about no matter where you live, you should have a quality education choice, no matter where you live in the state. And we're in a predicament right now where there are some parts of the state, not only do you not have necessarily a high quality option, you don't even have an in-person option. And for us, where you live should determine if you have access to a teacher, to a quality education. And again, the premise of your question, back to that, we hear from parents on a regular basis that are trying to help their kids at home, and especially when we see the enrollment numbers about pre-K and kindergarten students, those students have some of those students have a really difficult time virtually learning at home. There's not a teacher there with them that understands how to help their student out on that curriculum. So we hear from parents a lot. We hear from a lot of the younger parents, parents of younger age students, that talk about how difficult virtual learning is when they have multiple jobs, when they're not trained as a teacher, when they don't have experience. And so we are very concerned on how far students are falling behind. And again, we are actively looking for better data sets so that we can see exactly where our students are.
Mr. Secretary, I have a couple questions for you as well. One, we've spoken to some parents who are concerned about standardized testing. Is there any possibility that would be put off for a year? And then my second question is, it appears that a number of districts have a much higher than normal level of students who did not re-enroll last semester and don't have any transfer papers. They are not enrolled anywhere, and some of them have started trickling back into schools and some have not yet. And is that on your radar? And what is there to be done about that?
Absolutely. The first question, the testing at the end of the semester is going to be very important. We have to know where our students are. That's not meant as anything that's punitive to the schools and where the people. We got to know where the kids are. We've got to know how well our students are learning, where they are at in relation to other states. We have to have that data set. I believe it's essential that we have that data to see where our students are. Again, we're going to have to pick up. We're going to have to make sure these students. We don't want these students to be lost academically. We need to know as a state where we are at the end of this year. Your second question there. I apologize, just your point.
Students who are not enrolled.
Oh, yes. Okay, I'm sorry. Yes, we're very concerned about why parents made that option. Why did they choose not to enroll their students? Is it because of the virtual option? Are they in a district that doesn't offer an in-person option, so they chose to wait a year to see if next year that option will be granted to them? Who are all these students? What are they doing now? Absolutely. We are actively looking to see where these students are and what they are doing for this school.
I have two for you. Maybe you want to pass this off. The first is, I know Operation Warp Speed is getting noticed out from the state. Overall, has Operation Warp Speed delivered fewer doses? Has it been slower than you all expected?
I'll let these guys come up and give you some specific numbers, but I'm so proud of the team. We're waiting on the numbers to come out. We're actually number 9 right now in the country in vaccinations per capita. In top 10, that's fantastic. And I think we're waiting on the numbers to come out. We actually think we're a little bit higher than that. I don't know specifically. I'll let them give the numbers, whether we have the numbers that we thought we were going to have projected, early on from the Trump administration. Yeah.
Right now, I think one of the 7-day average cases is extremely high. Some hospitals have never said that they were about what they're going to do when they start to run out of resources, prioritize which patients they're going to take care of. Do you feel like anything additional needs to be done right now, or what do you think needs to be done right now to get this further?
Well, we're actually working on that. Our executive order expires tomorrow, and so our health department is working on what requirements to renew, and so for restrictions to renew. 1794, I believe, was the hospital capacity. That stayed pretty flat for the last a couple of months or so. That's always a concern of ours, and something that we're constantly in contact with health professionals and the chief medical officers at all the different hospitals. Dr. Yes, Stacey, Matt.
Great question. I appreciate it. Look, yes, there are a number of things, and I appreciate. I read the article too, and I talked to Integris. We speak to them daily, and so what they're doing is projecting their plan. They're talking about future plans. Everybody has a plan on the shelf. So the answer is, are there things that should be done? The answer, absolutely. I think whenever you see terms like the rationing of care, that invokes fear, but it doesn't tell the whole story. The whole story is that if we're just beginning to see a selective reduction in certain procedures, probably procedures that could have been reduced a long time ago at certain hospitals. So those numbers we watch daily. We obviously track them. We discuss with the hospitals there. And let me walk through a few of the things, if you could, that we've done to aid in this. And the hospitals generate this list. They ask for these things, and some of these things are eligibility for at-home health care. We've provided that. Right? Presumptive eligibility for long-term care placement. That's been done. We've reduced the decision time for insurance for the movement to the next level of care from 72 hours to 24 hours. That's been done. We authorized and ongoing authorized to work through CMS outpatient infusion. That's really large and very valuable service, outpatient infusion services. Additionally, outpatient and what we consider day outpatient surgery centers or day surgery centers are eligible to keep patients overnight. Most of the major hospital systems have those in their stockpile, and they don't use those for COVID patients right now. We've paid over $85 million in direct financial aid to hospitals. Significant. We continue to provide no-cost testing and no-cost vaccine. We'll continue to do so. And then we've worked actively with their list of difficult hospital to discharge patients, work drill, try to get those patients out of the hospital, free up those rooms, and then finally we activated the RMRS to aid in the transfer of patients between the hospital systems. So things that could continue to be done is before there's any type of rationing of care, as the article put it, I mean, we would expect a full reduction in selective procedures, not a partial reduction, a full reduction to create that capacity. We would expect more participation from specialty hospitals, focus hospitals. That's 1,080 beds that are out there that can treat COVID patients, and we watch those regularly. And the commitment as of last week that they're committed to 36 beds for COVID patients. So we expect more participation from those specialty hospitals. Those are your hospitals that are typically performing what you would consider your elective procedure. That you're truly elective procedure. We expect more participation from them before we get into any type of rationing of care. And then finally, we expect the hospitals to continue to convert outpatient beds into inpatient beds. And so there are a lot of steps to get there before we see any type of what you call rationing or care. We have a lot of levers still to continue to pull to get there. So that's something that daily we work with the hospitals to make sure that those numbers are trending in a direction that is manageable for the hospital and manageable for the state. So we're ahead of the curve.
Governor, could I ask you one thing? It dawned on me, you mentioned that you want parents to make the decisions about their students or about their kids, where they're going to school, what they're doing. You want that decision made at the dinner table. And I think you said not in a union hall somewhere by people who may have their own agenda. I think I actually have to go drop some documents off at the OEA later, so they probably would like me to ask what you meant by that. I mean, are you hearing stories of, have you talked to the unions? Are they saying they want to keep schools closed? I think I have heard that a little bit, but can you elaborate on what you meant by that?
Yeah, I just want, when all the dust settles, COVID's behind us, I want everybody in Oklahoma, I want everybody to know that kids need to be in school. I want kids in school. And so we can spend it however you want to spend it, whoever's not opening up schools, not giving kids the option for in-person learning. Kids need to be in school. The stat speaks for itself. Tulsa Public Schools, a high school student has not been in class in 305 days. So you can write what you want about it. I don't know exactly what's happening. I'm trying to be transparent with the data, trying to share with Oklahoma every single day. The data speaks for itself. Kids need to be in school, and I think now actually you're seeing that movement as well.
I don't want to, and I don't want to write whatever I want. I want to write what everybody thinks. But Governor, have you heard from unions specifically? Have you talked to them? Okay.
And that looks like that ended abruptly. I heard the press person say that's enough, and that was apparently the end of the press conference there. Well, there you go. I'm not sure of everything going. Remember, we didn't hear the very beginning of the press conference, and one of my friends was there in person, and it sounds like this was a tweet sent out by Ben Felder, who was there. Remember, when we started this, the governor's office had technical issues with audio, but to open his press conference, Governor Kevin Stitt reiterates his desire for all schools to return to in-person learning, says some school districts refuse to let their parents send kids to school, and he basically called out Oklahoma City Public Schools, and then toward the end, called out Tulsa Public Schools. That's what we missed at the beginning. There was a little bit more, but I don't think anything too big. But again, Governor Stitt announced a new policy that schools that enforce the use of masks will not have to quarantine potential exposures unless the individual is showing symptoms. So for here, Guthrie Public Schools has where you have to wear a mask. Students, teachers, staff, anybody that goes into the school building has to wear a mask. So what the governor's office is saying is if in a scenario where if a student tests positive for COVID, the school district goes through a seating chart, and if you're within so many feet of the person who tested positive, then you had to basically contact trace, and you would have to leave school for 10 days. and then go back, even though you don't have any symptoms. But now, if you don't show any symptoms, there's basically no more contact tracing from the governor's office. I'll try to reach out to the superintendent of Guthrie Schools and see what that means for them. If all this is just going down. So, but Dr. Frye details new guidance, which does not apply if exposures occur during after-school activities like sports, and it does not apply to people who actually test positive. They must still isolate at home. That's still pretty common sense there. If you have the COVID, if you test positive, you're going to have to stay home and you're going to have to isolate. But perhaps in the schools now, the governor's office saying basically no more contact tracing, stay in school. As we did hear that numerous times, kids need to be in school according to the governor. Dr. Frye also says new state policy will allow students and school staff members to avoid quarantine after in-school exposure as long as they do not show symptoms. Again, stated multiple other states have gone this direction and have not shown increased outbreaks. Of course, out of state, if there's an outbreak here, the governor's fault? Is it the school district? There's a bunch of that stuff. That's why this thing is so back and forth, all that good stuff. But anyway, I will try to detail all the information for Guthrie News page from the governor's office, and also see what Guthrie Schools will go with. The other side note there is watching that press conference, the Secretary of Oklahoma Secretary of Education, Ryan Walters. Of course, that's a cabinet member for Governor Kevin Stitt. I'm curious if Joy Hoffmeister, the state superintendent of public schools, who is elected among people, if she was talked to about this and got her opinions or share. I'd be curious what she always has statements after these type of events. So I'd be curious to see Joy Hoffmeister's response to the governor's announcement today, if she's on board with that or not on board with that, or if she was even notified of what was going on, or if they asked for her input on that. Obviously, she's the elected member, has a board to bounce things off of. So just an interesting thing that I got off there. So anyway, well, I will try to piece everything together and put an article together. Before I leave, though, real quick, let me get over here to... I promised here I have not gotten this information out as far as an article, but here it is from the Logan County Health Department. The Logan County Health Department will hold its second COVID vaccine event this Thursday, January 14th. Last Thursday had the first vaccination event at the Logan County Fairgrounds. But this Thursday, January 14th, from 9 a.m. to 3 p.m. at the Logan County Fairgrounds Education Building, for those who have an appointment. Now, it has already been filled up, so if you don't have an appointment, this doesn't apply to you. But if you do have an appointment, when you come, please enter through Mineral Wells Park off of 2nd Street. And so enter through Mineral Wells Park on 2nd Street. I'm sure there'll be more traffic control up there from the sheriff's office and the police department as well. Well, again, I apologize for the technical difficulties that the governor's office had, but hopefully you got the gist of that, and if not, we'll catch the article here in just a little bit. Thanks for tuning in. This has been a press briefing by Governor Kevin Stitt here on Guthrie News Page. So long.